So I'm doing this vlog. It's Saturday, so it's Monday to Tuesday, Tuesday to Wednesday, Wednesday to Thursday, Thursday to Friday, Friday to Saturday. This is day 5 post-op from a 2-level cervical disc replacement. I was going to do a vlog yesterday too. Honestly, there was not much to talk about that I won't talk about today. I thought about it and I feel pretty good. I did change out the dressing. This is the second time I changed out the dressing. This transport clear plastic, waterproof stuff can pretty much found in, I think I got it at Walgreens. And I have a non-stick gauze pad. I folded over a little bit, if you could see it, so that it would fit the actual suture over the sutures, because the gauze pad is the same length as the plastic stick on that's over top. And I think I talked about this earlier. As it starts peeling, it starts looking really weird. And I think it looks almost as gross as if you were just looking at the scar itself. It did fall off today while working out. I did not want my children to see this scar, so we tried to avoid them seeing it. I think they're a little young, and I think it would freak them out a little bit to see that, so we tried to avoid that. I can tell you that most physicians, PS, will tell you not to touch this. I understand it's a suture site. They're probably worried about contamination. If you do have to change it out, again, I'd probably speak to your physician and ask, but mine was peeling off and it was very sweaty from working out. Second time it happened. I think they're worried about you contaminating it. Like, you're just touching a lot of stuff, then putting, the bandage, touching the bandage, putting the bandage over top, then snacking it on top. And obviously now you just create a nice grounds or host site for a lot of bacteria to grow. So they're probably very concerned about that. And I understand that. That's probably why they just say, leave it alone. I think, my thoughts were, I didn't have a choice. It just fell off and I still wanted to keep it covered. The wound still looks pretty fresh. So I was just super careful, washed my hands multiple times, and then took the gauze pad, again, folded it very carefully, not to touch the area that's going to touch the cut or the suture site, and then put the plastic over top. It is a little tricky to do on yourself. As you can see, this area over here kind of folded over itself. This stuff is super thin. I think in an ideal world, if your spouse was on board, you could probably lay on your back, and gravity would allow it to fall pretty evenly. Once again, not advising to do it, but if you have to do it, you got to do it, and you would talk to your physician ahead of time. So yesterday I was thinking about what I would talk about. Throat feels really good. Still a little bit tough to talk sometimes. When this gauze pad fell off in the plastic, I noticed my range of motion was much easier. I think the main restriction right now is this thing, and it's tugging on the suture site, so you don't want to pull on it too much. You're still trying to avoid extension. Another reason why if somebody helps you do this, it'd be a lot easier, because you really just have to lay back maybe with a pillow on your back and you could just put it on. For me, I did have to kind of go chest up, and be very careful not to extend. That's the biggest range of motion they want you to avoid right now, is extension. So, once I applied that, we're back to normal. I thought about it yesterday. The things I want to talk about were what I felt like helped me not deal with too much discomfort leading it after post-surgery. Obviously, getting a good surgeon is a good idea. Dr. Perna and Dr. K with Atlantic Spine Specialist in West Orange, New Jersey, did an excellent job, so shout out to you guys. But leading up to that, my office, the physical therapist and myself, an exercise physiologist, just came up with a plan. I did a lot of exercises for my neck leading up until surgery. We wanted to make sure my neck was nice and strong. This surgery really doesn't touch the muscles, it moves them out of the way. And that's one of the reasons why you can jump right back into feeling fine afterwards, because nothing is really being cut, it's just being pushed that away. And it is sore for a few days as it's pushed that away, but a lot of the muscles don't get affected as a result. So you definitely want them strong. A good set of strong muscles around the neck post-surgery are going to help support the neck. They're not going to you're not going to be doing this a lot. After a few days, you'll get used to it and your shoulders will drop down to normal and it feels okay. So I think that was a big part of the success. I did do a lot of careful range of motion stuff prior to the surgery. I received chiropractic adjustments, acupuncture to relax the muscles of the traps when they're often tight, trying to guard it. And of course, physical therapy, we did a lot of exercises, again, for both the neck and the shoulders, just trying to get the muscles ready. Now, strategy following surgery, you can't really do much. They really restrict you the first couple weeks. One thing they do let you do is cardiovascular stuff without pounding. So they don't want you running, right? They want you to avoid running. And I get that. Now, I don't think you want to do anything truly exertional, because if you see this thing, this suture site is still very delicate, and you obviously don't want to tear it open. So you do want to do some low-grade cardio. Now, as a performance guy who works with a lot of athletes, pre and post-surgical, we do see a lot of people who have to compete in our office. I could quote a number of studies that show the drop-off between strength and cardiovascular. Cardiovascular is going to drop off first. And this goes for anybody, injured, vacation, whatever. After 14 days, the cardiovascular drop-off is more steep. So if you know that, and you know you can't really lift during this for the first 4 or 5 weeks or so, you really want to concentrate on your cardiovascular anyway, because that's going to be a drop-off quicker. You can lift heavy leading to it, and that was one of the strategy I did. I knew going into it I wasn't going to be able to lift for 4 or 5 weeks or so. So I went into the surgery with a lot of heavy lifts, 1 rep max stuff, as best I could right before surgery, also doing a lot of cardio, but right up into surgery, because I knew I would have a month of really not being able to lift heavy. So I took advantage of that, and I said, this is an excellent time to recover post-surgery, not only the surgical site, but my legs, my knees, my shoulders. So I was trying to, I did a lot of heavy lifting, 1 3 rep max stuff, multiple reps, high volume of low rep, heavy stuff. I'm taking advantage of this month to recover from that, but I'm trying to maintain my cardiovascular as best I can. So you can't run, but you can do inclined treadmill. It's at least, from what I've interpreted of it. Again, speak to your physician, talk to him about strategy. Speak to your physical therapist, talk about strategy. But inclined treadmill can really get your heart rate going. And I'm talking like way up there and a walking pace. And again, I think I talked about this a couple days ago. Do not hold on to the sides and get the grip of death on it. That's going to irritate the traps in the neck. Just a normal walking pace, but fighting that hill. And your heart rate's going to skyrocket. So I do progression. I start every 5 minutes for the 30 minutes. I'll increase it 1 degree, and I'm up to 10 degrees. I do start, I think, about 3 or 5 degrees incline to start, and I'm going to get that all the way up over the next couple weeks. And I do that for 30 minutes, and then I do my own thing, which I don't agree with. You shouldn't do if you're not used to working on treadmills and stuff. I then turn around and do an incline backwards at about 2 miles an hour at 15-degree incline. It might really burn up my quads. But if you're just looking for the cardio, incline treadmill is awesome. Today, Saturday, I did use the Peloton. I didn't do anything crazy. I just went on a bike. I did a biking program. I found it fairly easy. I usually use the treadmill Peloton program, but obviously you can't run. So I used the bike, and I did it. Thought I got a good cardiovascular workout in, nothing crazy. Again, but I think the most important thing is to just continually keep your cardio going. Remember, blood flow circulation is going to help this thing heal. If you sit down and you're sedentary, the return to just a normal lifestyle when this is over is going to take so much longer. Most people are getting this surgery or in their 40s and 50s. And you can, if you recall, if you're in your 40s and 50s, you get a flu and you're out for like a week or two, just lay it out on your back, how long it takes to get back to your normal workout routine cardiovascularly. Usually strength comes back quicker. And this applies for this too. If you could do cardio and you could sneak in some really good cardio workout during this without, breaking the rules and running and critting and pounding, I think, and I hope that my comeback, once I'm allowed to run, will not be as steep, and it won't be as hard to get back to my normal paces and whatnot. So we'll see. Again, day 5. I guess we'll find out in several weeks from now when I get to being late to start being able to run, how I handle the running right away. So again, I'll probably post again maybe tomorrow, Monday. Not much else going on that's changed. The biggest event was just changing out and cleaning the dressing. And again, you can find this stuff, this clear waterproof covering, and you want non-stick gauze pads that are sterile to replace it if your physician allows.